My name is Lauren Cooke, and I'm a first-year resident here at the Duke Department of Otolaryngology. As a prospective applicant applying to ENT last cycle, I was really looking for a program that would be really welcoming, and culture was my number one priority. When I interviewed at Duke, I knew right away that this was a group of residents and faculty who would become my family, and that was what really drew me to Duke as a department. Residency is long and hard. You really want to be surrounded by people who are both supportive but will challenge you. And I knew that when I met the residents that they would be there for me throughout the next 5 years, that I would come out enormously well trained, and that I would have faculty and mentors to push me to be the absolute best otolaryngologist, clinician, researcher, mentor, and just person after the 5 years that I spent here at Duke. Being a trainee at Duke is one of the most challenging but rewarding things I have done thus far in my life. I have been astounded day in and day out at the resources of this institution, at the strength and collegiality of the faculty and residents. We have an incredible nursing staff who have been enormously supportive to me as an intern who's really just navigating and finding out how to take care of patients in this new setting with a new responsibility. And I think that training here at Duke has provided me with the skills so far that I've needed to really be successful in that. I am constantly impressed by all the opportunities I've had as a trainee, and I know that there are just more to come. Durham really has a lot, and I've enjoyed using my time out of the hospital to find some work-life balance and do the things that I really love and enjoy. The Durham food scene is unbelievable. Since we've been here, we've tried lots of different restaurants. I also love to be outdoors. There's lots of great trails and hikes and things to do. If you're a water person, there's some great local lakes. I'm a big wakeboarder and water skier, so I've been enjoying that in the nicer summer months. And there's a booming cultural scene. I love musicals and have been to DPAC for Wicked and a few other shows so far, and that's an enormous opportunity for people who are interested in live performances, as well as concerts and other events that happen in the downtown space, which is really bustling and booming in my opinion. As someone who came to Duke for a second look that was specifically oriented towards diversity, equity, inclusion, I can personally say that I know it's a very important pillar of both our department in otolaryngology as well as Duke as an institution. We have countless efforts, including a new health equity curriculum that is designed to really improve residents' experience, faculty education, and just overall importance of DEI. Duke is absolutely a global leader for a multitude of reasons. But the first is that the institution has access to some of the greatest minds and resources of any medical establishment that I have been a part of throughout my training. We have researchers who are really cutting edge. We have access to AI, machine learning, and things that are pushing us to discover some of the next big things. We work with various partner sites for medical missions globally, including a recent trip to Tanzania with Dr. Barrett and Debbie Pan, one of our PGY4s, as well as global research opportunities. One of our fourth-year residents is currently in South Africa doing research on hearing outcomes. So you can see that Duke has a multitude of options within the global health realm and as a global leader to improve care and health for all. As a prospective applicant, I know that most programs are going to train you to be an excellent clinician and surgeon, but for me personally, coming to Duke was an easy decision because I found my people. I personally can say, having spent long days at the hospital and then choosing to spend more time with my co-residents afterwards, that I found the perfect fit here at Duke, and I couldn't be more thrilled.